The CDC has new updated guidelines on when opioids should be prescribed to patients. 9 News health expert Dr. Payal Kohli joins us to break down these guidelines. Thanks for coming in.
Good morning, Corey.
This is a big problem. Opioids is a big issue right now. So what are the new guidelines and recommendations, and how is it really going to help out patients and doctors?
I'm so glad that they finally put something like this together, because we haven't had any updates since 2016. And the idea here is to really give a roadmap to prescribing doctors and to patients who might be using these opioids for, surgical pain or what have you. These are not chronic pain patients, but the ones who need it for short term and then end up getting addicted. So the guidelines really tell us, first, do we need an opioid medicine, or could you use something non-opioid? What dose of opioid to use for what duration and how long, so that you're really using the lowest dose possible for the least amount of time, and then really have a plan as to how to follow up the patient, and most importantly, how to get them off. Because what often happens a lot of times is you write a bunch of prescriptions, the patient starts taking them, they feel better, and before they know it, they've become addicted.
So this is like a conversation of, do we prescribe them an opioid, or can they just take like Tylenol or something at home to get them over like this first couple hours?
It's exactly right. And so it's really a shift in our heads as providers, and also in patients' heads, as to how we respond to pain. Because in the past, we've had this philosophy where you have to eliminate pain. But the idea here is not to eliminate pain, it's to treat it so that it's tolerable with, again, using non-opioids, which can be very effective. And if you are going to need opioids, just use a very low dose.
How do you know? I mean, they can be very addictive. So how do you know if you're becoming addicted or if you are addicted to a painkiller right now?
It's actually crazy. You can get addicted after even a single dose. You can start to have that addiction get uncovered. Now, there's some of us that are predisposed to getting addicted, and it's those people who have the high or the euphoria that gets triggered. So it's not just the pain relief, but actually the euphoria. But you know that you're addicted, which can happen as early as a few days if it starts to change your behavior, if you start to have withdrawal symptoms when you don't take it, if you're having cravings, or if you're using it in a way that's unhealthy or excessive.
When you looked at these new guidelines, what are the key takeaways?
For a patient that might be worried about getting opioids, we overuse them. So the data tells us that in 2017, doctors, for every 100 Americans, wrote 58 opioid prescriptions.
Whoa,
yes.
That is a lot.
It is. And so this is a wake-up call for us that we really need to think about alternatives, and for patients to ask their doctors, if they're having a surgery, a knee scope or a hip or something else, is there something else that I could use? For patients to have realistic goals going into surgery, that they're not going to be pain-free, but we want to get them, able to mobilize with very little pain, so to speak. And then for patients to really make a plan to get off within 4 weeks. 1 to 4 weeks is about the longest you should be taking for acute pain.
I've been prescribed opioids a few times for various things, and I usually never need them. It's always Tylenol. So I think that this is answering that, like maybe we can scale back a little bit.
Yeah, exactly.
Good guidelines. All right, good topic. Thanks for coming in, Dr. Kohli.